Westminster, normal again. Well, sort of, after the coronavirus catastrophe that was worse here than in much of the world. And the question is, were our experts, officials and leaders culpable? At the start of the year, the sickness was rife in a Chinese megacity that few had heard of, Wuhan. But it wasn't till late January that the government convened its Cobra Emergency Committee, in theory to prepare our defences,
Going into Cobra now,
though the PM didn't attend till March. In early February, who knew that just a couple of months later the Prime Minister would get really ill with coronavirus and would be admitted to this hospital? Well, on the 11th of February, very senior members of the government knew there was such a risk, because one of them said to me that 60% of us could end up with the virus, and that could lead to 500,000 deaths. Now, I assumed they would then be pulling out the stops to protect us, but it didn't happen for weeks. Why on earth not?
I don't know. I wish I knew that one better. If you think about some of the measures that we've now accepted and seem to be perfectly normal almost now, they were unthinkable back in, beginning of February.
And as a former health secretary says, Boris Johnson's government wrongly thought it was fighting a very old enemy.
There was a kind of groupthink that this was a flu-like virus, that if it took hold here, would be virtually impossible to stop. And that was a groupthink that went back to when I was health secretary, even before that.
Here in Downing Street in February, they didn't seem to notice that in Korea, Singapore, Taiwan and even China, a combination of testing those with symptoms and extreme quarantines was curbing the spread of the virus. And although the SAGE committee of experts identified on the 18th of February that the UK didn't have enough testing capacity, it didn't recommend emergency action to expand that testing capacity. Instead, testing in the community would stop when the virus was spreading fast, which duly happened on the 12th of March.
If we had learned the lessons of SARS, we would have seen that mass testing is unbelievably important with this type of virus. I think in fairness, the government has learnt those lessons now, which is why we've seen that the expansion in testing capacity. But in those early days, our mentality was still that get to a certain point and there's no point doing any more testing.
I think the testing capacity was a huge issue. And I think what we were probably doing was just working within those constraints rather than probably saying, these constraints are mad. We need far more testing capacity. I think probably that was a mistake.
How do you get an organisation like SAGE in a way to be a bit bolder?
Yes, that's a good question. I think we did become bolder. I think maybe at the beginning we were. I don't think timid is the right word, but I think we did become bolder.
And even in early March, some hadn't worked out that the way to stop infection is to socially distance.
I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody, you'll be pleased to know, and I continue to shake hands.
More chilling is that a whole month later, in April, government advice was that COVID-19 tests were not required to be carried out by hospitals on patients being discharged to care homes, which had lethal consequences.
We knew care homes was an issue. It was discussed. And I think it was just then we moved on, because it's so obviously that was early on it was discussed.
The bit that doesn't make sense to any of us is that up until well into April, there is no requirement on hospitals to test older people for COVID before they go back to a care home, which just doesn't make any sense.
It makes no sense at all. I agree completely. I didn't know about that until you knew, until it became public. It's up to others to action that and do it, and that clearly failed.
The big priority was to make sure that we had enough intensive care beds and enough ventilators for anyone who needed to be hospitalised. So a series of decisions were taken which at the time seemed completely logical, but in retrospect we know were wrong, like discharging people from hospital without testing them, for example.
The Cheltenham Festival, the 10th to the 13th of March. Now that's a viral breeding ground. On the 12th of March, a very senior member of the government talked to me about what he styled herd immunity, what they thought was the inevitable, but also thought beneficial phenomenon of certain people getting the virus, recovering, and then being, to an extent, immune.
That was never a kind of a strategy to follow that we discussed, I don't think. The strategy was, though, unquestionably at that time, wasn't a strategy of trying to stop the epidemic completely.
I think they thought once this establishes itself, it will be in practice impossible to stop it spreading to less than 60% of the population. And so, unfortunately, we're stuck with waiting till herd immunity. But I think that was obviously the wrong approach, because if you've got a disease which at the time had about a 1% mortality rate, then you really do have a moral obligation to do everything in your power to stop it spreading.
They were the choices made and not made in February and March that led to more deaths per head of population in the UK than in pretty much any other rich country. Now, was that bad luck or bad judgment by the ministers, the officials, the experts who often met in the building behind me? And have they at last learned those important lessons? Well, for better or worse, we'll know soon enough.
And Robert is here. Look, I think a lot of people watching that will find that quite shattering in its detail of really a lost month, as I understood it.
Yeah, that's right. I mean, look, the fact is the government was given an enormous amount of relevant information about how to tackle this virus. And you've just heard John Edmunds, distinguished scientist, member of the committee, advising the government, saying right at the beginning his committee told the government to protect older people in care homes, and frankly, in his view, they simply didn't do what the scientists expected them to do until well into April, at a cost of thousands of lives. You also heard him saying that his committee now, not just the government, made a mistake in not expanding testing capacity in February, but rather deciding in March, when the virus was ripping through the community, that the test would only happen in hospitals. And so his view would be, many would agree, that we waited way too long to gear up testing. Now, the government has said to us tonight, it always followed the science. Well, John Edmunds has just said it didn't always follow the science. It also said, in response to something that I also said in that piece, which is that I was told on March the 12th by a very senior member of the government that they were looking for herd immunity. Well, they say herd immunity was never their aim. Well, I never said it was their aim. You've just heard the former Health Secretary, Jeremy Hunt, not saying that it was their aim to allow it to rip through the population until enough were immune. But he said, and I think this is right, they didn't know at that point how to stop it. And that, for most of us, is chilling, given that there was evidence, particularly from Asia, about how to stop it.
OK, Robert, thank you very much indeed.